Hi, thank you for joining us today for the SNF Agora conversations on the politics and policy of COVID-19. I'm Jonas Nam. I'm the Assistant Professor of Energy, Resources, and Environment at the Johns Hopkins School of Advanced International Studies in Washington, D.C. We're talking today as part of an SNF Agora series, which is a relatively new institute at Johns Hopkins that examines challenges to democracy and identifies actionable solutions. They created this new weekly series to offer a social scientific and an evidence-based approach to exploring many of the difficult political and policy issues that are arising right now around the pandemic. And I'm excited to be part of it, leading today's conversation on climate, food insecurity, and COVID-19. Joining me today are Martin Bloom, who's the Robert S. Lawrence Professor of Environmental Health and the Director of the Center for a Livable Future at Johns Hopkins, and Jessica Fanzo, who's the Bloomberg Distinguished Professor of Global Food and Agricultural Policy and Ethics at Johns Hopkins University and a colleague of mine at SAIS. Thank you both for being here. So the rules of the road for the conversations are that we'll spend about 30 minutes discussing how COVID-19 has exacerbated existing challenges for communities living with food insecurity. We'll talk about what food insecurity is, what causes it, how food insecurity is affected by both climate change and the current pandemic, and what we can do about it. We'll then open up for questions. And at any time during the conversation, you can chime in and submit your question through the dialog box that's either at the bottom or next to the video. I should say ahead of time that we can't answer any medical questions on this webcast. And so with that, let's begin. Jess and Martin, for sort of many of us living through the COVID pandemic, I think the lockdown has really exposed vulnerability in the food supply chain, maybe for the first time. Many of us have faced empty supermarket shelves. We've dashed about town trying to hunt down flour or yeast or cooking oil. Many have stocked up, fearing that items would become unavailable. And it certainly made us all think about food in a different way, as something that we've taken for granted and haven't really spent much time worrying about. And so before we get into the weeds of today's conversation, I'd like to ask both of you to maybe explain what food insecurity really is from a scientific perspective and how it differs from sort of the stress we've had at the supermarket in recent weeks. Jess, maybe you can take the lead.
So maybe I'll give kind of more of the formal agreed upon definition of food security, but maybe Martin can give a humanized version of what is food insecurity. So when someone has food security, that means that they have at all times physical, social, and economic access to sufficient, so having enough of food, safe food, and nutritious food that meet their preferences and dietary needs to live a full life. That is the classic definition of food security. And when you think about that definition, you could argue whether or not a lot of the world meets that definition. And we know that many in the world don't. But food security is obviously a much deeper issue. And I'll let Martin expand on that.
Yeah, I think one of the problems, of course, with many of these definitions of when we talk about food security, it is what kind of profession do you have? When you're an agriculturist, food security means something very different than when you are a physician or when you are a nutritionist, for example. So, and it doesn't mean that there is one definition which is the only one which is the best. And it's actually quite clear that, of course, even in this COVID-19, that this complexity actually is playing an important role. Which angle do you take? So if you look at, for example, the UN, many agencies who deal with food security are actually agencies like the FAO, as well as the World Food Program, for example, and they're all based in Rome, and they focus very much on the food production, until in fact maybe the consumption. But other groups who also work on food insecurity, like, for example, the World Health Organization in Geneva or UNICEF, for example, they deal much more what actually it meant for the consumer or whether it meant for certain groups like children of a mother. So, and that's actually, has a different angle. And I think so all of that is important. But so when we talk about healthy food, again, it means, is it to prevent diseases, or is it because, you have enough to eat, and I think what we are seeing now is actually a mixture of all these different problems.
Let's get to talking about sort of the impact of COVID-19 on the global food supply in a minute. But before we get there, I'm wondering if this is sort of the first time that the world has faced such a sudden and a kind of global shock to its food system. And Martin, you just mentioned the World Food Program where you worked. And so I wonder if you could share a little bit of your experience maybe with past food insecurity and shocks from that perspective.
It's definitely, I'm now 2 years with Hopkins, and it's fantastic to be at the university. But of course, I had a former life, and I worked almost 13 years at the World Food Program, and before that, I was actually involved in many of the nutritional issues with Helen Keller International. So, so over the past 20 years, I've dealt with, for example, the Asia economic crisis, also with the food crisis in 2008. With wars, of course, the Syrian war, droughts, floods, cyclones, earthquakes, but also with diseases like, the Ebola crisis, as well as the HIV/AIDS crisis, had quite some impact on food insecurity, as well as on nutritional issues in those different places. So, but I must say that the shock we are dealing with today with COVID-19 is quite unique. And it's unique. Let me go back to again. So if when you work for World Food Program or you work for FAO, then you want to tackle the problem based on the cause of the problem. So when you have a drought, of course.
One second. What does FAO stand for the folks who are not?
The Food and Agriculture Organization. It's I think it started just after the Second World War, and it deals with all the problems of agriculture, food production mainly. But it's interesting because so when you want to tackle a problem, you need to analyze what the causes are of the problem. So when you have a food crisis in 2008, when the prices of the staple food like rice and wheat are increasing, then automatically, of course, it has consequences for food insecurity. But you also understand what to do to solve the problem, because you have to reduce the food prices. No? When you deal with Ebola, you have to understand, okay, what is the disease doing to that particular community, and the epidemic, will it actually expand, and who actually are the victims? And so if you go back, for example, to the problem of HIV/AIDS, which is interesting because it's a disease we deal with a lot of food insecurity as a result of that. But the disease, the virus is actually very specific. It kills, in fact, white blood cells. And it does that in a period of 6 to 10 years. And at the end of that period, when you have not enough white blood cells, you get actually an infection like tuberculosis, and you die, not from AIDS actually, but you die from the infection. And related with that, you have to analyze what you will do on food insecurity. The interesting part of COVID-19, it's a very different virus. No, the virus actually, first of all, it's actually chat viruses, so it is infectious even before you get the symptoms. But the disease in itself is almost a reflection of what actually is the problem of food insecurity at the global level. If you would consider, the world as a victim of COVID-19, it is the same. The COVID-19 doesn't kill because of it kills cells. It does kill some of the cells. But the main issue is, in fact, that in the second week of the disease, you get an enormous response of the immune system. You get a cytokine storm. And because of the cytokine storm, people get actually so sick that that their lungs are not functioning well, and eventually they can die from it. So in a way, what the problem is with COVID is like originally you have to contain an infection, but what's happening what happened in fact in Italy is very interesting, because the main consequence of the pandemic or the epidemic at that time in Italy was that the whole healthcare system collapsed. And because of the healthcare system collapsing, the the government had to close down the system. They had to lock down, in fact, people, because they had to, to change the curve so they could actually handle the healthcare system. And similar things happened, of course, in New York. So the main reason for the lockdown is not much the disease, but it's actually the consequences of the disease. And because of the lockdown, you will have different consequences at the global level, as well as at the country level, as well as at the state level, as well as at the community level on food insecurity. And so it's a very important, to make that point, because it is so you have to question, how do we deal with the lockdown in relationship with the disease to look at the consequences on food insecurity? And what I've seen in the webinars over the last couple of weeks is that they isolate the problem as a food insecurity instead of actually linking it with the characteristics of the disease as well as the consequences of the lockdown. I must say that the way New York is handling it's one of the best examples to me, how they look at the tension between the COVID-19, the health aspects of the disease, and as well as with the consequences of the economy. And how do you, if you want to go to you open up the economy and in fact deal with food insecurity, you need to realize who are essential to solve that problem. And you have to do that from a medical perspective. So for me, it's really interesting that in fact, it's the response, which is actually more important than the disease itself.
Let's get back to COVID in a minute. Jess, you do a lot of work on sort of the interaction between food systems and climate change. And so we're kind of entering this pandemic at a time where we're already dealing with all sorts of other pressures. And so I wonder if you could talk briefly about sort of the climate context to all of this before we then figure out how COVID is making it even more challenging, as Martin just laid out for us.
Yeah, I think, one of the things Martin has articulated is this idea that COVID, it's a very kind of different shock to the food system. We've had other shocks like food price crises in 2008 and 2010, 2011, which Martin had talked about. And then we have this kind of somewhat slow, but increasingly becoming much more rapid, insidious shock called climate change, and all of the repercussions of climate change on climate-related natural disasters. Again, what Martin had mentioned around all of the floods and droughts. And it's interesting to me, how dire the situation is with climate. If we stay on this business as usual scenario that we're on towards a much warmer world, and this is a situation where we have a lot of data. We know a lot about what's caused it, the Anthropocene, human-induced. We know a lot about the consequences, and we know how to adapt and mitigate. But what's interesting is, why have we not taken action in the food system to address the climate impacts as opposed to the response to COVID? So, both Martin and I have been working, and Jonas, you work on climate change. We've been working in the hunger sphere for a long time, as well as climate change. And it's fascinating to me that we've had real world examples of pretty big shocks, maybe not like COVID where it's hitting every system, right? You have a shock that hits the health system and it's has social, economic. But it's fascinating to me. I was sort of giving up on this idea of, why can't we get the attention of governments? We still have 821 million people who are hungry, and climate change is barreling down on us. Why do governments not care? Why are they taking no action on this? And then COVID comes along, and there's been massive action in a very fast way, right? And I kind of had given up on this idea that governments can act quickly, but I'm really shocked at how fast they can act quickly. So to me, the question is now, can we take that momentum that COVID has shown, these cracks in the food system, these cracks in the health system, the vulnerability of our economic system, a lot of that on the back of the food system, laborers, et cetera. How can we take that momentum and try to fix and adjust the food system for future shocks? But climate's one of those examples where we have this long shock. We're moving towards 1.5. They're anticipating multiple breadbasket failures of maize, rice.
What's the breadbasket failure?
Breadbasket failure is when the major staple crops of the world, between 1.5 and 2 degree warmer world, will start to fail. We will not be able to produce enough food to feed the world's population. And somewhere between 1.5 and 2, which the world will head to in this business as usual approach, we'll see 40% declines in maize, 23% declines in soybean. So some of these major crops that a lot of our food, people still consume a large portion of their calories from those foods, will have failures. And that will have big implications on food insecurity and pushing more people into hunger, food insecurity, et cetera. And those aren't even the nutritious crops that Martin and I care about, right? That's not the fruits and the veg and the animal source foods, which are all very much under pressure right now with COVID. But yeah.
So we are then suddenly, so we have this creeping crisis, and now we have a sudden crisis on top of that that's affecting virtually every country at the same time. Maybe we can talk about some of the concrete challenges that are arising. Martin already started some of the concrete challenges that are arising out of the current situation. I wonder, Jess, if you could talk a little bit about Africa. I think you just published a piece on sort of the impact of COVID on food supply in Africa, and I'd be curious to hear your thoughts.
Yeah, Africa's sort of in this precarious situation, right? They have the highest number of undernourished or food insecure people in the world, the continent of Africa, with obviously a lot of diversity in those 50 plus countries that make up the continent. So they already have some vulnerabilities. They still have a lot of infectious disease burden, as Martin mentioned, HIV, AIDS, TB, malaria, neglected tropical diseases. But at the same time, Africa has a few things going for it, and it depends on how those things are exploited. One of the negative things is the social distancing might not work in a lot of these urban, dense slums for Africa and Asia. But Africa has a young population. So they may not see, depending on the more we understand this virus, I think we're still at the very tip of understanding its implications and how it manifests in biological terms. But we may see less hospitalizations and deaths. Africa's got a bit more time. They've watched the rest of the world handle this, right? So they've been watching, they've got like 2 months. They have experience with some pretty bad infectious diseases, West Africa with Ebola. The DRC kind of clamped down very quickly on that second surge of Ebola this year, and it didn't make the news, right? No one knew about it, but they've done pretty good. They have much more experience in handling infectious disease than we do. The HIV/AIDS era did build public health systems. They did strengthen their public health systems as opposed to 2 decades ago. So they're not starting from zero. And 60% of their population is still rural. If people can get to rural places that are still quite spread out, and farmers can get access to be able to produce food, the seeds, fertilizers, extension, all the things needed to really boost their food supply, they could keep their food supply going. What we're seeing though is, across, and we can talk about this a bit, in the food supply, a lot of laborers aren't able to get to fields, right? They're not able to move. It's the movement of food. Exactly. Ships sitting in docks, not able to unload food. Labor is not being able to get to farms. Equipment, seeds, production technology not able to move. So we've got a big supply, we've got a massive demand. The value chain in the middle is broken down. And it's whether or not Africa can pull that together. They struggle already with infrastructure and their food supply. So they could see a real breakdown there, but they do have some things going for them, and Africa's resilient. So I'm crossing my fingers for Africa that they come together, and we're seeing the Africa Union just came together to discuss COVID and develop this global continental collaboration. They did it in Latin America too. So let's hope.
One of the kind of interesting things about this pandemic is that it's affecting both developing and advanced economies sort of at the same time. And so, Martin, you're also a medical doctor. And so I wonder sort of what the linkages are between nutrition, the disease. I mean, you know, I live in Washington, D.C., where a kind of a disproportionate share of the deaths were really in community of color, not just the infections, but also the people who died from it. And I wonder if there's a link between, you know, food, nutrition, and how the disease plays out, you know, not just in developing economies, but also here in our neighborhoods.
Yeah, it's a very good question. In general, I think Jess made it very clear that if you look at the food system, many of the problems are always, you know, eventually among the poorest. You know, sometimes the poorest of the poor. I think COVID actually also has a quite big impact in low middle income countries on the middle class, because particularly in the urban areas, because they, you know, because of all the restrictions, also they don't have an access. But if you look at the, you know, like in the US, there are two different elements, of course. So there is an issue of inequity, which is related with poor access to healthy food, less access to healthcare systems, as well as, of course, the disease itself. Well, so far, most of the papers have shown that people who are at risk of dying are people who are older, people who have, you know, comorbidity, you know, cardiovascular diseases, diabetes, and obesity. And of course, then if you look at populations which have a higher morbidity of those diseases, they're also at higher risk of actually dying or being, you know, victim of this pandemic. But at the same time, if the same group also have less access to healthcare systems, as well as less access to, in fact, food and the healthy food, you have a double, like almost like a double burden of those problems. And we are seeing this, of course, in many vulnerable groups in the US, but particularly among you know, people of color, because they are at risk of both of those elements. And but I think that when you are saying, okay, we are seeing similar things now in the US or in Europe, what we were seeing, for example, during the 2008 crisis of the food system in the rest of the world, I think there's an important lesson. I think, you know, I like to come back to what Jess was saying, because I think it's really important, the points she made. I think there's no problem of availability. And we see that staying also in the US. There's no problem of availability, although it starts to be. You see it a little bit in the meat industry, you know, because of the workers. But that's actually, that still will not, because we produce so much, that will not actually have any implications for actually what your needs are. So the main issue of COVID, I think, is again, it comes back to that countries or states or regions are actually isolating themselves. And because of the isolation, in fact, you get huge problems of food insecurity, as well as who are the bigger victims of those food insecurity, again, are the vulnerable groups. So if you have a job like us, for example, working in the academic environment, we can actually work from home. You know, it's possible for us. We can still read the literature. We can still actually do education. We can teach. So yes, of course, it's not as nice if you can actually teach in the classroom, but we can still continue to do work. But it's very different if you are, for example, have a job, you know, in the retail sector, for example. So we need to realize that if we want to solve this problem, and it comes also back to all the points I think Jess is making for climate, we need to start to work together. And it's interesting, like, you know, coming from the UN in 2015, we came up with the Sustainable Development Goals. And one of the key elements of the Sustainable Development Goals is that it's not anymore about them, it's about us. We're all in it, no? Which is really important. And COVID-19 has shown us that we're all in it. But also that the solution is not for nothing. They have one goal, which is partnerships. And partnerships means how we can work together. How can we come up with, you know, common solutions? And I think it's a good starting point. And I really like what Jess was talking about climate. Like there's not too many governments that take action. And they took action for COVID, which is a good thing, of course, because it's essential. We don't want people to die from it. But we need to learn from something. This should be the beginning of rethinking how we can actually deal with food security and how we can deal with climate. And the fact that the vulnerable groups are more actually at risk now, even in the US or in Europe, tells us something, that this is not the first crisis will happen. You know, people who actually are working in this field of One Health, who deals with, in fact, the potential pandemic, will tell you there will be a next pandemic in the next 5 or 10 years again. And maybe this will be a pandemic not only focusing on the elderly, will focus on the whole population, and we all are at risk of dying, for example. So we need to realize that, and that's of course linked with how we deal with the food system. So I think it, to me, you know, when we talk about, I didn't talk so much about climate. I talked mainly about the disease itself and what maybe the consequences is when you are, for example, obese in the context of the disease. And I think it's essential to have that knowledge too. But the main issue of the problems in the world is that they're all interconnected. You need specialization because you need to understand what the details are of COVID-19 to make it more effective. But if you don't understand how this is linked with food system, how this is linked with the economy, how this is linked with climate, we are making a similar mistake. We, you know, then we don't have a discussion whether we should open up the economy or whether it's economy versus the disease. No, it's related. We need to make a decision which is good for the economy, which is good for people, which is good for the healthcare system, which is good for food security, for example. And I think I think climate, as people who dealt with climate always realize that everything is interconnected. But people who are dealing only with diseases, sometimes they thought, okay, it's only my field is only leaking. You know, when I go to the hospital, that's what, you know, as a doctor, this is what I do. Now you realize, no, it's not. I deal with COVID-19, it's a disease. But if I don't understand where it's coming from, what's influencing, who are the other victims, like, you know, I just heard from one of the physicians in New York, a person was dying from you know, just, you know, an appendix, because he was not, you know, willing to go to the hospital because of COVID-19.
Yeah.
And so you see a lot of people are dying, not because of the disease, but because of the consequences that the healthcare system is collapsing. So we need to understand interdependency. That's what I think is very important.
This is a perfect transition. I want to spend a few minutes before we get to audience questions to talk about some of the opportunities in this current situation. What can we do about it? Jess already mentioned sort of this, you know, you both have now talked about the speed at which government has responded. I'm really interested from a climate perspective what we'll do with the stimulus funds and the kind of recovery period and how we can use them to really affect structural change. And I wonder if there's a parallel in the food world. What can we encourage governments to do as they face this crisis to really sort of implement systemic change, really to make us more resilient to future crises? Jess, maybe you want to go first. I don't know who has good ideas here.
I mean, I'll give a few, and then Martin can add on.
Yeah.
I think, I mean, we need to get from an opportunities perspective, we need to get the food supply moving, right? We can't rely on the food stocks that are currently in play. I mean, we're seeing there's plenty of meat right now, as far as there's not a major large scale shortage of meat. We're seeing it in pockets, but that could quickly change if the food supply doesn't get moving. And one of the biggest things we need to consider is how do we keep our health workers safe so they can actually deal with the COVID crisis. They're key, keeping them safe, but also keeping the food laborers and food producers safe. You know, so if we are asking for supply chains to keep moving, how do we provide the mechanisms to get producers, processors, anyone who works within the food system to keep working, but in a very safe and dignified way. So that's kind of one of the big things that we absolutely can't wait for. To me, the two other big things are really, we need to employ safety nets. We're seeing it in the United States. Food banks, for example, are just completely at their wits' end. We're going to see this in Africa and Asia, where people have lost their jobs. They can't get to markets because of curfews or lockdowns. They can't, remittances aren't, World Bank just reported that remittances are going to be down. So people are going to not have the kind of cash that they had before. So we need safety nets. People need cash infusions, vouchers, food assistance. A World Food Program is going to be super important in this, and other organizations like that. And to me, the third is, Martin mentioned it, but it's this One Health idea. This is the idea that the WHO and others promote, WHO being World Health Organization, the UN organization responsible for global health. This idea that we coexist with animals and their environments. And we need to think about disease spread, our ecosystems, and how we engage with animals. And to me, we need to understand how wildlife habitats are being threatened, the impacts of climate on that, and how that could potentially cause zoonotic pandemics in the future. We need to be much more prepared and thinking together. And we do that at Hopkins, not to promote Hopkins, but we do think about the environmental health, the human public health, climate, environment, and how those all engage. Because to me, we have to take this much more holistic vision if we want to stop future zoonotic pandemics from happening in the future.
Yeah.
Do you have something brief to add? The questions are
trickling in. I think I would like to add a little bit, because it's exactly what Jess was saying is, for me, it's so incredibly important. The Center for a Livable Future worked over the past 25 years on really being very much looking in what we call the externalities of the animal food, or the industrial animal food production, and so. The One Health, or what some people call the spillover, of diseases, zoonoses, like those are really, really, really important. And most of the big pandemics, if you look at influenza, you look at COVID now, but look at potentially SARS or Ebola, those are all spillover, diseases. And some people don't make sometimes the link, So if you remember a couple of months ago, we had the burning of so much fires in the Amazon, and more and more of the Amazon is destroyed because of the production of soy. You say, okay, that's soy, that's a plant, that's great, but all this soy is used as feed for animals. So we produce so much, animals, like in the US as well as in Europe, that's not essential for our nutritional status. In fact, it's the opposite. So, and as we know that, the production of a lot of animals actually create a much higher greenhouse gas emissions. And so that's not very good for the climate. So we really need to think about how we can actually change the diet, much more plant-forward diets. That doesn't mean that you have to exclude all the animal source food, but definitely not the amount which we are consuming now. And that will have huge implications for how we actually deal with agriculture and how we actually eventually prevent some of the climate issues. And this is even go beyond I would say the which is also definitely an important element too, but like, how we deal with animal welfare, and, and some of these ways is not, but that's even like just pure from a climate perspective. We need to shift our diets, and we need to rethink how we actually produce our animal source food. And I think it's an important message. And then if you go back to your other questions you said before, I know I will stop, but like, you look at diabetes, you look at obesity, it's definitely way how we actually produce our food, and that we are actually far away from actually what is really essential. And it only happens in the past 20, 25 years, as you know.
Let's take a few questions from the audience. Folks, if you want to submit a question, it's not too late. So ask away. I think one question that has been repeated here a few times is sort of the role of the federal government in all of this, and should the state, the government, take a different role in regulating the supply chain, becoming involved in agricultural production? Is there sort of a role that the state can play to help with these changes that it hasn't played in the past?
I mean, I think the state definitely has a role to play in protecting workers and setting out guidelines that align with the World Health Organization and the CDC on how, um, as things open, how that should be done. And there are guidelines out there, and other countries have been following them, and some of the states are following them, of course. And a lot of it, again, is around food worker protection. But I think there's a big role to play from private sector too. You know, these private
That's
sector.
another question.
The private sector has a massive footprint on the food system across all aspects, from production to distribution to processing to um, to retail. And I think they're feeling the pressure right now economically, and they have a big role to play in this, in partnership with governments and government mandates and regulations. So I think we can't think that just government alone will act. We need private sector to um, be able to be empowered to protect their workers and ensure that they're following certain regulations that governments are putting in place. I think it's very confusing in the United States right now of because we've got the federal government, but then we have state government, and things are playing out differently state by state. But I think we've all seen, even our local food systems. You wonder why some of the food workers in the stores aren't wearing masks, right? Or they're not given masks, or they're not adequately protected. So I think there's just some basic things that need to be put into place by the government and be required if we're going to reopen up the food supply. I don't know, Martin.
Yeah.
I have a second question for Martin, actually.
Sorry.
Someone just chimed in and asked, so you talked about, I think that was in response to what you just said previously, Martin, that we really need to kind of reduce our consumption of animal foods, essentially. And so the question is sort of, what can we do beyond calling for people to go vegan? And what are sort of the tools in the public health system that are available to encourage better diets?
Well, first of all, I didn't say that you have to become a vegan or that you have to become a vegetarian. I believe a flexitarian. It's not actually what I believe. I don't think just from a realistic perspective, I feel we need to go more to a plant-forward diet, which has there are many different ways to do that. But we definitely have, to reduce our animal food intake in Europe and in the US. Or maybe in Latin America. Those are the three, continents which have the highest intake per capita. And there are many places like in India and even in Africa, where in fact, for example, in India, I think the annual consumption of meat is less than 5 kilograms, when in fact I think in the US, it's over around 200. So there's completely, I would say, not an equity in the consumption. So we have to be very careful when you look from a global perspective what it means. So
I think on the individual level, though, too, I think,
absolutely too. Yeah.
I completely agree with Martin that we are going to be shifting towards this more flexitarian diet. There's so many benefits to it. But I think, minimizing food waste in your house, try to use all your food, right? Support a local CSA, and I can never remember what it stands for. Basically, support your local farms. Many of these farms are trying to distribute local baskets every week. And a lot of these local farms, you can buy one for yourself and buy one for a needy family. Support your local food bank, right? And to me, the most important thing for everyone out there is stay healthy, stay home, stay healthy. And yeah, but I think on the food side, and actually the flexitarian diet, if we get into a situation where meat does become a shortage, a lot of the pork, 65% of the pork is produced in the Midwest. If there becomes a real problem with those processing plants, we could eventually see meat prices go up in a year or two. If there becomes a shortage, or if the processing plants don't get up to speed on protecting their workers, a lot of the ranchers and raisers are going to either keep what they have and feed them longer, or they're going to pare down their stock. So food prices could go up. You could see people consuming less meat, like we saw in the United States after the 2008 food price crisis.
Should we encourage this, though, at the sort of institutional level? Should we say we are taxing meat, or we are, I mean, you've both made appeals to kind of individual responsibility, and that, you know, I wonder if there is a way to kind of help individuals along, or is this something that the public health community thinks is too kind of draconian? What are you
so can I respond to it? Because I think it's to me, it's really interesting. I'm reading recently also a lot about history, like, you know, what happens over the last century, for example, in Europe, particularly in Europe, because of the Second World War and the First World War, and you know, having fascism there, and you know, communism there. So I think it's extremely important also when we think about you know, the Sustainable Development Goals, and particularly also, of course, climate, that we have definitely an idea where to go to. But the moment we start to create blueprints and we say, this is what you need to do to get to that point, it can be really dangerous, because at that moment when you start to have a blueprint, you know, when you're not part of the blueprint, you're out. And so I think there needs to be enough flexibility in what the choices are of people, so that in fact they can make the right choices. And it's possible. I see, you know, so I'm actually an optimist in that sense, because if you look over the past 10, 20 years, we have already changed our diet. Like, it's not for nothing if you look at there is a shift in much more from red meat, for example, to white meat. I'm not saying that white meat is all perfect, but the point is it's already there. So some things are happening. And so the moment you can see that too, even the lockdown is really important to prevent, you know, that we don't have a destruction of our healthcare system. But people also get aggressive, say, you know, I don't want to be. And this is not only in the US, it's also in Europe. We see it everywhere in the world. So the point is that we need to find a way to actually have very strong ideas where to go to. But the moment we start to be restrictive, I think there will be no possibility. So we need that space that people have choices, but that they will make automatically the right choices. And people say, well, it's education. It's not only education, it's a whole mixture. So I'm an optimist that we can change, but I don't believe in very strong ideologies. Because I think that actually will, but of course, from a medical perspective, of course, we know that safety is important. But are we very clear about what is actually essential so far? No, and this is what comes back to the previous question you asked. We need, in fact, collaboration between states, that's the federal government in the US, and in Europe, it means that we need the EU working together between the different countries. And I think what Jess said before, that the African Union is actually start to work together with the countries is amazing. That's exactly what we need. You know, we need to kind of, so that we have a common goal. And with the common goal, the translation of the common goal can be different. I can imagine that for example, in the context of Florida, maybe it is essential that you can go to the beach because it's a touristic place. But in New York, maybe it's essential to get all the people who work in Wall Street that they can work. Do you see? I'm not saying, you know, maybe it's a bad example, but I try to say that each of the different places have different people who are essential. And when they are essential, you can actually protect them against COVID. And that's the way we have to think. You know, like we have a big goal, but the translation at the local level can be different.
So we have a global problem, and we need local solutions for all of.
Yeah, but you have to switch. It's all the time going from the details to the big picture, and then back again to the detail. And some people stick here, and some people stick there. But we need to go, and that's why I think I must say I don't want to repeat myself, but I like how New York is dealing with it. It's a very you know, they make mistakes, but I think they definitely understand the tension between public health and between the economy and between food security. And I think we need to understand that it's not an easy choice. If it's an easy choice, everyone will do the right thing. It's a difficult choice, but there are choices, and we can help.
I'm getting strong signals that we need to wrap up. We're running out of time. Jess and Martin, thank you so much for these insights. I could have gone on for at least another 3 hours or so, and thanks for all the questions from the audience. I'm going to shamelessly borrow for sort of the wrap up something that you just said, Martin, in the conversation. To me, as someone who works on climate, I think one of the big lessons or kind of opportunities from this pandemic is this us versus them thinking, and you articulated that really, really well in the conversation. Sort of this idea that it's not about them, it's about us, and that this is showing us that we really need to come up with global solutions and work together. And so I think that's a kind of optimistic and nice thought to end the conversation on. Please join us again next Friday for a conversation about how COVID-19 might change globalization as we know it. Our guest next week will be Nazneen Barma, who's the associate professor in the Department of National Security Affairs at the Naval Postgraduate School. Hal Brands, the Henry Kissinger Distinguished Professor of Global Affairs at the Johns Hopkins School of Advanced International Studies, and Henry Farrell, who's a professor of political science and international affairs at George Washington University. Thank you for joining me. Thank you, audience, for joining us. I just want to mention quickly that there's a recording of the webcast that will be available at snfagora.jhu.edu, and I hope to see you again next week.
Thank you.
Thanks.